Welcome to Nursing Matters by the RN Network, the podcast where we dive into the latest news, trends, and career guidance for nurses. Each episode brings you insightful interviews and discussions with key leaders in healthcare, exploring the issues that matter most to nursing professionals today. From navigating your career to understanding the changes shaping the nursing landscape, Nursing Matters is here to keep you informed and inspired. Nurses, are you ready to expand your professional network, build meaningful relationships, and engage with fellow nurses from all over? Join the RN Network online community on LinkedIn. It's the perfect place to connect, share experiences, seek advice, and even post your own insights. Whether you're looking for career advice, job opportunities, or simply want to be a part of a supportive nursing community, the RN Network has you covered. Ready to join? It's easy. Visit rnnet.org/LinkedIn-groups to sign up and become part of a thriving community of nurses just like you. Again, that's rnnet.org/LinkedIn-groups. Don't miss out. Network, engage, and grow with the RN Network today. Hello, everyone, and welcome to Nursing Matters, the go-to podcast where we cover the latest in nursing news, career insights, and everything in between to keep you informed and inspired. Today's Tuesday, October 29th, 2024, and we've got an insightful lineup of stories, from COVID-19's impact on nursing assistants to advice for nursing students balancing work. We're deep diving into topics that really matter for the nursing community. So whether you're on your morning commute or winding down for the day, we're here to bring you news, insights, and maybe a smile or two. Let's jump in. Let's kick things off today in a fun way and go to Texas, where nurses are using an unconventional but effective teaching tool to make CPR training more engaging and memorable. Nurses at a Texas hospital recently incorporated singer Sabrina Carpenter's hit song as a beat for CPR compressions, showing that music can be a powerful tool in critical situations. Since CPR requires compressions at a consistent rate, about 100 to 120 beats per minute, matching it with a song can help people remember the rhythm needed to save lives. The nurses hope this fun, rhythmic approach will help people feel more confident performing CPR, whether they're healthcare professionals or bystanders. Using music to guide CPR compressions isn't new, but it's gaining popularity because of its practicality and effectiveness. According to the American Heart Association, songs like Stayin' Alive by the Bee Gees or Dancing Queen by ABBA provide the perfect beat for CPR compressions. Studies have shown that pairing CPR training with music helps learners remember the correct rate more reliably than just traditional training. Music offers an intuitive cue that sticks with people, especially in high-stress situations where remembering instructions can be challenging. Beyond just helping people remember the rhythm, the use of music in CPR training makes the learning experience more enjoyable, reducing anxiety around the technique. A study published by the Journal of Emergency Medicine found that participants trained with music were more likely to retain their CPR skills and report feeling more prepared to assist in emergencies. For nurses, teaching CPR with music can also engage younger audiences, as today's pop hits provide a fresh way to connect with the community and reinforce these life-saving skills. This approach highlights the creativity nurses bring to community health education and how impactful they can be outside of the clinical setting. Nurses teaching CPR can incorporate these musical cues to make training sessions more memorable, particularly when working with school groups or community workshops. For nurse educators and trainers, using music also aligns with the current trend of making health education more accessible and engaging. It's a perfect example of how nurses adapt to connect with their communities, using a beat to keep everyone on rhythm, quite literally saving lives to music. Now let's talk about an important topic for our Canadian nursing friends, transferring your nursing license to work in the United States. This process, while straightforward in some respects, can be complex due to differences in credentialing requirements between Canada and the U.S. Nurses from Canada need to understand both state and federal regulations, as each state has its own specific guidelines on licensing. For instance, some states may have different educational requirements or mandate additional exams like the NCLEX, even if you're already licensed in Canada. The National Council of State Boards of Nursing outlines that verification and credential evaluation can take anywhere from several weeks to months, depending on the state and whether additional documentation is needed. Recently, there's been a push to streamline these processes to make it easier for international nurses to work in the U.S., especially with the demand for skilled nursing professionals at an all-time high. Canada and the U.S. have collaborated in other areas of healthcare, and many advocates are hopeful that nurse licensing will see similar reforms to make transitions smoother for qualified professionals. This move towards easing license transfers reflects a broader trend of increasing global mobility in healthcare. With nurse shortages continuing to be a significant issue in many parts of the U.S., hospitals and healthcare organizations are increasingly open to recruiting international nurses. The U.S. Bureau of Labor Statistics has projected a steady increase in nursing demand, and meeting this need may require a more flexible approach to licensing. For Canadian nurses, this could mean more streamlined and supported pathways into the U.S. healthcare system in the coming years. For Canadian nurses considering a move to the U.S., this transition could mean new opportunities, but it's essential to start the process early and keep all required documents organized. U.S.-based nursing roles offer unique chances to specialize and explore diverse patient populations, so if you're considering this move, know that your dedication to making it happen can lead to exciting career growth. You've got this, and there are plenty of resources out there to help make the transition as seamless as possible. Up next, let's dive into a question many nursing students wrestle with. Should you work part-time in healthcare while going to nursing school? So this is a decision that's as individual as it gets. Working part-time can offer hands-on experience, a sense of real-world application, and a bit of financial support. However, it can also require students to balance work, studies, and personal time, a challenge that, if not managed well, can lead to burnout even before officially entering the nursing field. A study from Nurse Education Today showed that nursing students who worked part-time often reported feeling more prepared for clinical rotations and patient interactions. But it also highlighted a higher risk of burnout among students who worked more than 15 hours a week while maintaining a full-time course load. This demonstrates that finding the right balance is absolutely crucial. Schools and healthcare systems should consider offering more flexible part-time opportunities specifically tailored for nursing students, which would allow students to gain experience without overwhelming their schedules. Burnout prevention strategies like time management training and resilience coaching are now being advocated for students balancing work and studies. Many universities are recognizing the importance of these skills and including them in nurse curricula to better prepare students. By teaching students to manage workloads and prioritize self-care early on, institutions hope to produce a generation of nurses who are both skilled and resilient. Research underscores that students who learn these skills early tend to have longer, more satisfying careers in nursing. For nursing students, a part-time role in healthcare can be a stepping stone into the industry. You'll get to practice skills like patient interaction, time management, and teamwork early on. But remember, your studies are a priority, so if part-time work feels too heavy, it's okay to step back. Finding a supportive work environment where you can learn without excessive stress can make all the difference as you build a foundation for your nursing career. Next, I want to highlight a fantastic initiative from Metro Health, which recently integrated virtual behavioral health services directly into its primary care offerings. This means that patients visiting for primary care can now receive mental health support as part of the same appointment, making care more seamless and holistic. For many patients, behavioral health care is either delayed or overlooked due to stigma or logistical challenges, so this integration aims to remove those barriers and prioritize mental health alongside physical health. Research supports that integrated behavioral health improves outcomes, especially for individuals with chronic conditions who often face compounding stressors. A report by the American Psychological Association found that mental health conditions are linked to worsened outcomes in physical health, particularly in chronic conditions. Metro Health's model, which includes virtual behavioral health services, aligns with growing evidence that integrated approaches result in better health, reduced hospital visits, and overall patient satisfaction. Virtual health is helping bring these services to those who might not seek them otherwise. In addition, the National Institute of Mental Health has noted that early intervention through integrated behavioral health care can prevent mental health issues from escalating, which in turn reduces overall healthcare costs. This approach could be a game changer for health systems looking to manage resources more effectively while improving patient care. Metro Health's integration is a promising model that other healthcare providers may look to adopt, given its potential to streamline care and foster a more comprehensive health approach. For nurses, especially those in primary care, this shift could be transformative. Not only does it allow for a more well-rounded approach to patient care, but it also gives nurses the tools to address mental health in a supportive, accessible way. Nurses are often the front line of interaction in healthcare, and with behavioral health integrated into primary care visits, you can help initiate conversations on mental wellness in a more structured environment. This approach can also lighten the emotional load on nurses, as the resources are available to address mental health concerns during regular visits rather than leaving it as an add-on. For nurse practitioners and primary care nurses, this model could also increase patient satisfaction, making healthcare more compassionate and comprehensive. Moving on, here's a story from Sinai Hospital, which has recently launched a virtual nursing program designed to improve patient care and alleviate some of the workload on in-person nursing staff. This innovative program brings experienced nurses into patient rooms virtually to handle certain non-physical tasks such as charting, answering patient questions, and educating patients about their care. By doing so, it frees up bedside nurses to focus on hands-on care, enhancing overall efficiency. Virtual nursing has been gaining traction as a model that not only maximizes nurse utilization, but also addresses staffing shortages. According to a Harvard Business Review article, hospitals that have piloted virtual nursing programs report better time management, with nurses able to complete patient interactions much more efficiently and still provide a personal touch. This model helps bridge gaps that the nursing shortage has exacerbated and allows experienced nurses who may have physical limitations or prefer not to work on site to still actively contribute. Studies have shown that patients often feel more comfortable asking questions and discussing concerns in a virtual setting. The American Hospital Association recently highlighted virtual nursing as a positive step towards personalized, accessible care. Sinai's hospital program could inspire a trend where virtual and in-person nursing work hand in hand, creating a more balanced environment for staff and a satisfying experience for patients. For nurses in clinical settings, the addition of virtual support can mean more time for direct patient care without the added administrative workload. This dual approach can improve job satisfaction by allowing bedside nurses to focus on what they're trained for, patient care. And for those considering virtual nursing as a career option, this is an exciting avenue to explore that aligns with flexibility and innovation in the healthcare sector. Attention nurses, are you ready to take your career to the next level? Look no further than the RN Network, your ultimate online community and job board designed just for nurses. Whether you're searching for your next great opportunity, need career advice, or want to connect with fellow nurses, rnnet.org has you covered. From exclusive job listings to valuable resources like continuing education and professional development, we're here to support you at every step of your nursing journey. So why wait? Head on over to rnnet.org and join the RN Network today, because your next opportunity is just a click away. Our next story is a breakthrough from genome sequencing originally developed for COVID-19 that's now being applied in NICUs to protect vulnerable newborns from infections. Genome sequencing can trace the source of infectious outbreaks, allowing healthcare teams to act swiftly in isolating and managing infections. For NICU patients who are at high risk for complications from infections, this technology could mean the difference between life and death. The National Institute of Health highlights that genome sequencing is a powerful tool not only for tracing infections but also for understanding the genetic makeup of various pathogens. This technology was instrumental during COVID-19, helping trace and contain outbreaks. Applying it to the NICU allows for a level of precision that can reduce infection rates among neonates, protecting the most vulnerable patients from hospital-acquired infections. Early isolation measures, guided by genome sequencing, can reduce transmission risks in hospital settings. By using genome sequencing to identify pathogens quickly, NICU staff can act on real-time data, minimizing exposure to other patients and reducing long-term risks for these infants. In the Journal of Hospital Infection, researchers have emphasized the need for rapid infection control strategies, especially for high-risk units like NICUs. This proactive approach can also alleviate some of the anxiety healthcare staff feel, knowing that they have a more effective way to control infections. For NICU nurses, this technology can be a game changer. Not only does it make infection control more efficient, but it also provides peace of mind knowing that infections can be identified and contained before they spread. Nurses can focus more on patient care rather than on the constant worry of undetected infections. This integration of advanced technology with compassionate care underscores the future of nursing, where innovation meets the highest standards of patient care. Let's talk about a career path that more nurses are considering these days: home care nursing. Home care nursing has grown in popularity due to the flexibility, autonomy, and patient-centered care it offers. It allows nurses to work one-on-one with patients in their homes, giving them a unique chance to provide a high level of personalized care. With an aging population and a rise in chronic illnesses, the demand for home care nurses is expected to grow significantly in the coming years. The Bureau of Labor Statistics reports that home health care is one of the fastest growing fields in nursing, projecting a 34% growth rate by 2030. This trend is largely due to the cost effectiveness and improved patient outcomes associated with home care services. Home care nurses often report greater job satisfaction as they can work more independently and establish meaningful connections with patients over time. Moreover, home care often allows for a more flexible schedule, which is highly appealing to nurses seeking work-life balance. Studies have also shown that patients in home care experience fewer hospital readmissions, making it a valuable option for managing chronic conditions. The American Academy of Home Care Medicine suggests that as more healthcare shifts out of hospital settings, home care nurses will play a crucial role in bridging the gap between hospital care and everyday life. This makes home care a fulfilling path for those passionate about long-term, relationship-based patient care. For nurses considering home care, this career path offers both professional and personal rewards. It's an opportunity to practice independently, develop long-term patient relationships, and provide holistic care in a way that is often not possible in a hospital setting. If you're looking for a change that aligns with work-life balance, and deeper patient connections, home care nursing might be just the fulfilling path you've been seeking. Let's take a look at the pressing healthcare access crisis unfolding in Western North Carolina after the impact of Tropical Storm Helene. This region, already facing healthcare shortages, is now grappling with intensified challenges as facilities try to rebuild or recover while still providing urgent care. The storm itself exacerbated existing issues, especially in rural communities that are often underserved. With limited resources and facilities stretched thin, healthcare providers are working to meet with increased demands, but significant barriers to access still remain. This crisis brings attention to a critical issue: how natural disasters can deepen healthcare disparities, particularly in rural areas. According to the National Rural Health Association, rural communities already struggle with healthcare access due to fewer facilities, limited transportation options, and a scarcity of specialized services. When a disaster like Helene hits, these gaps become more visible and pronounced as hospitals may close or reduce services and patients might be unable to travel to the nearest open facility. It's a harsh reminder of the vulnerability in rural healthcare systems, where even minor disruptions can lead to major access issues. Emergency preparedness experts have long advocated for increased support for rural healthcare infrastructure, emphasizing that these regions require disaster-ready solutions tailored to their unique challenges. Studies from the American Journal of Public Health reveal that post-disaster care often fails rural areas due to the lack of dedicated funding and emergency planning for long-term recovery. This is particularly relevant now as more extreme weather events are anticipated due to climate change. The response in North Carolina could serve as a case study, prompting policy changes and resource allocation for future disaster responses in rural settings. For nurses working in rural or underserved areas, the impact of a crisis like this is deeply personal and professional. It highlights the critical role nurses play in both acute care and ongoing community support when resources are scarce. Many rural nurses take on multiple roles, from emergency response to chronic care management, often with minimal support. This situation underscores the need for nurse leaders to advocate for better disaster preparedness policies and resources for rural healthcare facilities. It's also a call to action for nursing organizations to push for systemic changes that strengthen the safety nets in these communities. This crisis in Western North Carolina is a sobering reminder of the essential work nurses do, especially in rural and disaster-prone areas. Nurses on the ground are not only healthcare providers, but also pillars of the community of resilience. As we wrap up today's episode, let's remember the importance of supporting our rural healthcare workers and communities facing these challenges. We'll keep you updated as this story develops, and let's continue to push for better resources and preparedness for all our communities. And that's a wrap on today's episode of Nursing Matters. We hope these stories have inspired you, whether it's exploring new technologies in patient care, creating ways to educate the community, or just finding new perspectives in nursing. Thanks for joining us, and we look forward to bringing you more next time. Until then, keep the beat alive, nurses.